Hello, welcome to my channel. I am Dr. Joe, Arabian radiologist. This is a sonography-radiology training channel. I will present different videos could be benefit for physicians and general population. In this video series, I will talk about fetus ultrasound and try to explain general information for pregnant women simply. This is the second video in this video series. One of the most requested examination is fetus ultrasound, which can be classified into the first trimester fetus ultrasound, the second trimester fetus ultrasound, and the third trimester fetus ultrasound. The clarity and quality of the ultrasound image and the safety of ultrasound waves for the fetus have made this method one of the prenatal care prerequisites. The structure and surface of the body and internal organs of the fetus are readily evaluated by ultrasound. Possibility of observing the embryo from the right angle in this method allows the physician to detect a possible congenital anomaly at an appropriate stage, to estimate the growth and state of the fetus, location and position of the placenta, the amount of amniotic fluid around the fetus. Currently, there are several types of ultrasonography that have similar applications, include routine 2D grayscale ultrasound, color Doppler ultrasonography of blood vessels, 3D and 4D ultrasonography. Please pay attention to this important point. Currently, routine 2D ultrasonography that provides physician with black and white images is the safest method of imaging during pregnancy, which is often used to confirm heart rate, rule out any problem or ectopic pregnancy, estimate the gestational age, determine the position of the embryo. Like this fetus with cephalic position means the head of fetus is upside down, and diagnose abnormalities such as Down syndrome. In general, entire embryonic parts and the vast majority of embryonic problems can be examined with routine 2D ultrasonography, include intracranial organs, nasal bones and face, upper and lower extremities, fetal sexuality, nose and lips of the fetus in the face, spinal column, fetus kidneys, fetus heart, bladder, umbilical arteries, and many others. And the use of 3D and 4D ultrasonography is applicable in certain and limited cases. Sometimes performing sequential 2D or even 3D and 4D ultrasonography is used to diagnose fetal apparent abnormalities such as cleft lip or some bone abnormalities, like this fetus with apparent cleft lip in upper lip. This is the 3D of the fetus, which shows the cleft lip obviously. But because the 3D and 4D types of ultrasonography impose more energy on the fetus, it should be performed only if necessary and prescribed by the physician. Contrary to the general impression, it is not the 3D and 4D ultrasonography that shows fetal defects better and more accurately. It is worth mentioning that the device does not detect fetus anomalies, but it is the radiologist that distinguishes the findings and identifies the abnormalities with his or her proficiency, which is also possible with routine 2D ultrasonography in many cases. Certain condition is necessary to create an appropriate 3D and 4D image, and the resolution of the created image decreases in cases where the fetus is moving or when fetal face is close to the wall of the uterus or placenta, like this 3D image of the fetal face, which we can see incomplete fetal face formation because it's close to the placenta. Many pregnant women tend to have their spouse in the room while performing ultrasonography. All mothers believe that performing fetal ultrasonography requires careful attention and sufficient concentration by physician, and the presence of patient companion can prevent these. Therefore, in many of the sonography centers, the presence of patient companion is prohibited. But in some centers, short-term attendance of patient companion is allowed at the end of ultrasound time if possible. If you like this video, please subscribe this channel. If you would like to get notification for the next videos, please press the small bell. If you have any questions or video suggestions, please write in the comments. Thank you for your attention.